Imagine hearing voices that no one else can hear, seeing things that others swear don't exist, or believing that the entire world is secretly plotting against you. For millions of people across the globe, this isn't a movie plot. It's real life. This is schizophrenia, a condition that has puzzled scientists for over a century and remains one of the most misunderstood mental health disorders in existence. So, what exactly is schizophrenia? What causes it? And what's really happening inside the mind of someone who lives with it? Let's dive deep into the science, the symptoms, and the human stories behind schizophrenia. What is schizophrenia? Despite what many people think, schizophrenia doesn't mean having multiple personalities. It's a chronic brain disorder that changes the way a person thinks, feels, and experiences reality. Doctors describe it as a syndrome, meaning it includes a group of related disorders that share similar symptoms but may have different causes. No two people experience it exactly the same way. For some, it starts quietly, small shifts in mood, social withdrawal, or unusual thoughts. For others, it appears suddenly, with intense hallucinations or delusions that distort reality completely. The first signs. The early signs are often subtle. Maybe someone starts acting distant, loses interest in hobbies, or seems off in conversations. But these early symptoms can grow stronger, leading to what psychiatrists call a psychotic episode, where a person may lose touch with reality. Typically, schizophrenia begins in the late teens to early 20s for men, and the late 20s to early 30s for women. That's also what makes it so difficult. It often appears just as young adults are starting to build their lives. Symptoms of schizophrenia. Doctors usually describe the symptoms of schizophrenia in three main categories. Positive symptoms. These are experiences added to a person's perception of reality, things like hallucinations, delusions, and disorganized speech. For example, hearing voices that aren't there or believing something that isn't true. Negative symptoms. These involve loss or reduction of normal functions, such as lack of emotion, motivation, or social connection. A person may seem flat, unmotivated, or withdrawn, not because they don't care, but because their brain simply struggles to express those feelings. Cognitive symptoms. These affect thinking, focus, and memory. Simple tasks, decision-making, or remembering information can become a daily challenge. Each category can vary in intensity, but together, they shape how deeply schizophrenia affects someone's life. Causes of schizophrenia. The truth is, there's no single answer. Scientists believe it's a combination of genetics, brain chemistry, and environment. Genetic factors. Schizophrenia runs in families. While about 1% of the general population develops it, having a close relative with the disorder increases your risk tenfold. And if one identical twin has schizophrenia, the other has roughly a 40% chance of developing it too. However, genes aren't destiny. They only increase vulnerability. Environmental factors, early life stress, infections during pregnancy, or complications during birth can all raise the risk. Even drug use during adolescence, especially marijuana, has been shown to trigger psychosis in genetically at-risk individuals. What happens in the brain? Inside the brain, communication happens through chemical messengers called neurotransmitters. In schizophrenia, some of these signals get mixed up. The main chemical involved is dopamine, the reward neurotransmitter. Too much dopamine in certain brain areas can cause hallucinations and delusions, the positive symptoms. But too little dopamine in other regions leads to lack of emotion or motivation, the negative symptoms. Brain scans also show that some people with schizophrenia experience slight shrinkage of brain tissue over time. Researchers are still studying whether that's part of the illness itself or an effect of medication. Either way, schizophrenia is not caused by bad behavior. It's a biological brain disorder, not a character flaw. Treatment and management. 9 ties to 1030. Treatment has evolved tremendously. Decades ago, people with schizophrenia were often misunderstood and isolated. Today, antipsychotic medications help regulate dopamine levels and reduce hallucinations or delusions. Older drugs mainly targeted dopamine alone, great for positive symptoms, but not so effective for negative ones. Newer medications, however, work on both dopamine and serotonin, offering better balance with fewer side effects. These medications don't cure schizophrenia, but they help manage it, allowing people to live productive, fulfilling lives. Stigma and misunderstanding. One of the biggest challenges isn't the illness, it's the stigma around it. Movies often show people with schizophrenia as violent or unpredictable, but studies show they are far more likely to be victims of violence than perpetrators. This harmful perception often prevents people from seeking help early, the time when intervention is most effective. Breaking. The stigma starts with education, compassion, and open conversation. Schizophrenia is not a hopeless sentence. It's a condition that deserves understanding, not fear. With the right support, early treatment, and compassion, people living with schizophrenia can thrive, work, love, and dream just like anyone else. Science is still uncovering its mysteries. But one thing is certain. Behind every diagnosis is a human being with a story worth hearing. If this video helped you understand schizophrenia better, don't forget to like, share, and subscribe for more science-backed insights into the human mind.